It is so important that people stay active, right? And whatever their passions are in, we want to, really fuel that fire. Dance has been proven to do so many wonderful things for people because they enjoy it and they get into it, right? Even people that have problems moving, like people with Parkinson's disease, right? We just need to find what it is that our patients like to do, or maybe that they used to like to do and they don't think they can do anymore, but we work on getting them back there.
Hello, I am Ben Braxley. I'm a member of the Academy of Orthopedic Physical Therapy's podcast team, and I'm bringing an episode of Orthostatic to you today for National Physical Therapy Month, which is focused on falls prevention this year. I'm having a great conversation with Dr. Jen Sharp of the University of Nevada, Las Vegas. She happens to be the chair of the Academy of Neurologic Physical Therapy's Balance and Falls Prevention Special Interest Group. And we have an excellent conversation as two fellow neuro nerds in the orthopedic world talking about where there's overlap between falls, fall prevention, and treatment of individuals who have sustained falls. So look forward to engaging with you all based on the conversation that I have today with Dr. Nash, and look forward to your feedback. Hello, and welcome to Orthostatic, the podcast of the Academy of Orthopedic Physical Therapy. I'm Ben Braxley, and I'm here today with Dr. Jen Nash. We're going to be talking about falls and orthopedic physical therapy. Before I get into some of Jen's bio, I'd like to kind of introduce myself. I'm a bit of an odd but passionate duck here on the orthopedic podcast team. I'm a neuro PT. And actually, Jen and I have quite a lot in common in terms of our neuro background and kind of the approach that we're coming to this orthopedic podcast with. So my current day job, I'm actually the senior program coordinator at Emory University at a new center for physical therapy and movement science, where I'm hoping to bridge some of the clinical practices, the research, and the education between Emory University and Emory Healthcare. My background is predominantly as a clinician, more in acute rehab, the space of stroke, brain injury, spinal cord injury rehab. I have done a fair amount of orthopedics in my day, though, so I think this is going to be a stimulating conversation, and I look forward to highlighting some of the amazing work that Jen has done in Nevada and elsewhere. So without further prelude, I will introduce, again, Dr. Nash. Dr. Nash has just an amazing resume in terms of where she's gone and what she does in this fall space. She's currently a professor at the University of Nevada, Las Vegas, and she chairs the Academy of Neurologic Physical Therapy's Balance and Falls Special Interest Group. That's how we connected. She's a community member on the PT board of Nevada, and she chairs the Nevada Goes Fall Free Coalition, which is a very interesting initiative that I hope we'll have time to touch on today. In addition to all of that, she has advanced credentials in multiple sclerosis, in exercise for aging adults, and I'm sure the list goes on. And she practices clinically as a PRN PT within Common Spirit Health, Dignity Health, a past employer of mine as well. So another place where our backgrounds overlap. So you may have called Jen at CSM in 2024 with her presentation Beyond the Clinic Walls, Promoting Health and Wellness Across Populations at Risk for Falls. So this is a very timely orthopedic podcast. The end of September marks National Fall Prevention Week, and then November is Fall Prevention Month, and here we are in October for National Physical Therapy Month. So Jen, welcome to the podcast. Is there anything you'd like to say further in introduction, or should I jump to the first question?
Well, thank you for having me. I'm excited to be here, and thank you for the Orthopedic Academy, I guess, of physical therapy, right? To think about bringing a neuro PT onto their podcast. I think you did a fine job introducing me, and I look forward to the conversation.
Excellent. So I'm going to start with a stimulating conversation question, which is, why should orthopedic clinicians think and care about falls and fall risk?
I think that's a great question. And I really think a lot of them do, right? We have people coming into orthopedic clinics every day with a shoulder injury or maybe a knee injury, a back injury that might have come from a fall. Whether they have orthopedic reasons for that fall, whether they have neurologic conditions that led to that fall. they're there, right? And what we need to do, I think we are in the best position to make sure we're asking about them because people don't talk about them. So making sure that all orthopedic physical therapists are asking if their patients have fallen in the last year, if they worry about falling, or if they're unsteady on their feet. Uh, those three questions, just by getting a yes to any one of those, increases that older adult's person, and maybe not older adult, but primarily older, right? Older than 65, we think of as having that higher fall risk. But a yes to any of those questions will lead us to know that they have increased fall risk and we should investigate further so that no further injury comes to that person, right? And that's what we want. We want to get them back doing what they want to do, and not just get them back to have another fall.
Absolutely. I mean, it's certainly true in the orthopedic population as it is in all populations. And I think balance and fall prevention is unique in that there's kind of a performance component that we think of maybe in orthopedics, like, not necessarily return to sport, but return to functional activity. And that is absolutely 100% true of our aging population, the population that is at more risk for falls. You make me think of screening tools like, for example, the CDC Steady. Do you have like a favorite fall screening tool or anything that you'd like to put on our radar in terms of screening a population that maybe you wouldn't necessarily expect to answer those questions in the affirmative?
Great point. I teach all of my students the CDC Steady toolkit. So this is a toolkit designed for any medical professional to use to identify older adults who have fall risk. And there's great components to it. Number one, there's a 14 question questionnaire that actually it's 12 questions, 14 points, but very easy to help identify areas that you might be able to help that person with, such as, are they rushing to the bathroom at night?
Mm,
That might not be a question you're normally asking, but being able to then get them to, a referral to a provider that can help them with that. It talks about, not having the good sensation in their feet anymore, having trouble stepping up over a curb. So that stay independent questionnaire, I think, can get a lot of information for the clinician to then be able to research a little bit further into that patient's condition and current situation. It also gives the person who's taking the exam an understanding of why they're asking each question. So I really like the stay independent questionnaire. If you get any more than 4 points or more, you are at increased fall risk.
wow.
But my
That's great.
students, also use all three performance measures. And
Mhm.
as a screen, right, they're a little bit different as far as the cutoffs that we look at, but we look at the 30-second chair stand test, we
Okay.
look at the 4-stage balance test, and the tug. And again, these are screens, right, to try to identify someone that might be at fall risk. So they try to cast a bigger net, but it's still helpful to, we can incorporate those quite easily into a plan of care for a shoulder or a back, just to understand the person's balance situation.
Yeah, I love 5 times sit to stand because it can be so quick. And if it's not quick, well, that kind of already has answered the question of whether or not they're at risk. I also really appreciate your point about sensation. I've worked with individuals with chemotherapy-induced peripheral neuropathy, and they are absolutely at risk for falls, especially in low light conditions, like you might associate with the older population. But these orthopedic clinicians, any clinician is likely to see someone who's been through chemotherapy. And if that's not on their radar to think, oh, this I need to consider how this is impacting them functionally in a variety of settings based on that potential for diminished sensation. So thank you for bringing both of those up.
And let me just add in that the Academy of Neurologic Physical Therapy has teamed up with the Academy of Oncology and just released October 1st, in celebration of PT month and fall prevention, 2 fact sheets, one for patients and one for clinicians about peripheral neuropathy. So
Fantastic.
yeah, check those out. The clinician one really guides you through different types of equipment you should use, different tests you should do, different exercises you could incorporate into your plan. And the patient guide, again, is more, descriptive and talking about why this is important to address.
Oh, that's great. It sounds like the Academy of Neurologic Physical Therapy is a sought after collaborator on these documents. Here we are today, and certainly APTA Geriatrics is also quite wise to partner in that regard. I remember this is years and years ago, but the Oregon chapter did a functional orthopedics for the neurologic clinician and functional neurologic skills for the orthopedic clinician, and those like kind of opportunities for cross pollination and overlap, I feel like are always so rich and rewarding. One of the reasons I enjoy my position at Emory is that it's just all across the board in terms of specialization. There are no silos when it comes to good collaboration and being thoughtful about the connections there. Which, falls is another one. You can't only treat the neurologic impairment. You can't only treat the orthopedic impact. It is truly cross disciplines within our field. So,
Agreed.
I want to transition to kind of the next point that I wanted to bring up with you, which is, when it comes to falls, like where is it a problem of age-related changes, balance-related changes, or the environment? I've always wondered, what percentage of falls are the origin is cat or small dog. I certainly know I've come close with my dog previously, but what's your perspective on age versus balance versus environment? And what can we do about that as clinicians?
I like that question. So I teach my students, and in fact, my students have gotten up recently in front of a group of older adults and described their last fall. All of us can describe one within the last year, right? Mine was running backwards in a gym. So one of my students was on the pickleball court, right? The good news with our falls is we usually bounce right back up, right? We have quick reactions. We're able to minimize our injury. And usually we're pretty agile, right? So as we get older, our tissues get stiffer, our reaction times might slow, and then the falls become more serious. And so that's why I think we are more concerned about them as we age. But all of us fall. I mean, none of us have a no fall risk, right? And
Absolutely.
especially the more we do, right? The more environments we challenge ourselves in. But as older adults, as we age, I should say, not it's a problem for all of us. We tend to more minimize the different environments we're in, right? My students might not in 5 years be playing as much basketball as they are, and therefore their head's not moving all over the place, and they're not having to be as agile and have the reactions and the plyometric ability that they do now, right? And as they
Yeah.
stop doing those things, the body doesn't do them as easily, right? If you don't practice it, you don't have it to retrieve that quickly. And so as our reactions slow, that's one of the things that can happen is falls as we get weaker because we're not doing the things that we maybe used to be doing. We're more sedentary as we go through this life experience, and therefore we lose some of the strength, right? Because if you don't use it, you will lose it. Even a bodybuilder that doesn't go to the gym for a month will become smaller, right? We know that.
Absolutely.
A person that hasn't been exercising and then lays in the hospital for a week is so weak that we can't even understand it, right? They were independent prior to this fall. Now they've been in the hospital a week and they can't even get out of bed by themselves, right? So I think that it's more about our experiences and how much we challenge ourselves. But it's also good to have a check-in with someone. Do we check in and let them know, hey, your balance is a bit rusty. We need to do some exercise. You need to practice putting yourself in those situations consistently, like daily, so that you'll have that to fall back on when someone pushes you, when it's dark or you turn your head quickly, which isn't something you do anymore, and you lose your balance, right? So
Absolutely.
I think that us giving the exercises and really talking about it helps them because environment is also a big part of this picture. We use our eyes for balance. If we don't have good lighting everywhere we go, we're going to have a decreased ability to balance. And as we age, normal daylight might not even give us great vision if we have glaucoma, macular degeneration, one of those issues that really changes eyesight, even, acuity, right?
Yeah.
Um, I'll even mention like medicine, right? As we age, more and more conditions come upon us, or we have more experiences that create uh, a need for medication. And as you start increasing the number of medication pills you take every day, you increase your risk of falling because most side effects to medication is dizziness.
Absolutely. I mean, you bring up so many good points. The polypharmacy, polytrauma, the risk of polytrauma goes up from a fall, as perhaps our bones are impacted by, you osteopenia and other
Mm-hmm.
conditions. So I love, one of my favorite lines that I'll use with my patients that I'm working with on balance is that my job is to have you do the least safe thing that you can do safely with me here as a support and a feedback mechanism. So looking for where that line is, one, so that they reflect on where the line is, and knowing what that ability can be, because as things change, our functional thresholds, our functional capacity goes down. So you've really spoken to all those points. We'd practice well together, Jen. I think I'd love
Yes,
to
we would.
be in a clinic with you on that.
Save the date for the 2024 AAOMPT Conference, October 23rd to the 27th in Orlando, Florida. Join OMPT professionals for 5 days of continuing education focused on OMPT, hands-on learning, research, networking, and more. Visit AAOMPT.org for more information.
So we've talked about some of the risks. We've talked about some of the environmental considerations. What resources would you recommend to a clinician who wants to learn a more structured approach of approaching changes to the environment, or things to consider that maybe aren't on their immediate list to check in with a patient?
Yeah. So I think something simple, because I know we're all busy, right? But the CDC, like you mentioned, the
Mhm.
Steady Toolkit has a great resource that you can just give to your patients, and they can go to their home and check through this checklist. And
Phenomenal.
they can safe proof their own house, right? So they might not think of the things that this checklist has. So it's good to give them some type of handout that they can take home and be able to reference. So I think that's one thing that I would say. Um, I also think there's a program by a physical therapist, Tiffany Schubert. She's an
Right.
amazing physical therapist in the fall prevention world. She's definitely a mentor of mine. She created Otago, or brought it to the United States, I want to say. And Otago, especially in this age where either telephone or Zoom type interactions can happen between patient and physical therapist, it is a program that helps uh, the person, a patient, really progress their exercise program after discharge. So if you're looking for a program to help decrease the fall risk of your person in front of you, why don't you start integrating Otaga into the last few sessions of your physical therapy plan of care, and then check in with them. All it is a couple check-ins to keep them accountable, but it really helps to keep them exercising, right? And that's such a big part of it. Walking does not prevent falls, right? We know that. There's a lot of literature. There's even literature that says 50 hours is required to decrease your fall risk by practicing
Oh,
balance, that
yeah.
much. But this can help them get on that pathway. It helps them get that 50 hours and can really start to create behavior change because it's over that long period of time.
I would be fascinated to know what other kind of biomarkers of physical activity change with that 50 hours of balance. How much is the balance intervention and how much is functional threshold, functional capacity that we touched on earlier. It's really, really fascinating. Great opportunities. And again, just to kind of pull our theme along as we go through the conversation, I mean, who better than a PT or a PTA to have these conversations with clients and look at where the functional rubber meets the road in terms of their abilities and their safety to do the things that they want to be able to do. So great points, great points. I have another question for you. And this, we've already touched on a little bit, but we'll see how this reframing changes the conversation. What are some individual or collective actions that you would like to see more PTs and PTAs get involved in with respect to falls prevention and awareness?
Oh, that's a great question. Now, I know that I have a passion for service, so this isn't for everyone, right? But I am out there. Um, in September, I am out in my community about 50 hours, making sure that I am providing screenings, getting my students involved in understanding and integrating, interacting with older adults and testing them using the STEADY toolkit. We do balance and memory screenings, actually. So we are
Fantastic.
out there at any type of senior location that will have us providing these screenings. I think that's a great way, number one, to even market your physical therapy clinic, but also give back to your community. I'm always looking, like I give out Dignity Health cards all day long at that clinic, right? Because what we do is we screen them with the STEADY toolkit, so that's their balance. We give them the mini cog, which gives them a little bit of insight into their memory. Then the students have a conversation with them talking about the different resources available
Mhm.
in the community. What type of evidence-based fall prevention programs that are out there and often for free in our communities can they get involved in? Do they need to really talk to a physical therapist because their balance is significantly decreased and we really think they're at a high fall risk? Well, this is, these are some resources to see that a physical therapist. We also include a dietitian there. We include a pharmacist. We also include mental health support. So all of these people give their time, but are experts that are really trying to help decrease all of the factors around a person's risk for falling. And so that's one. I really think it's something that I am very proud of here in Nevada. We screen throughout the whole state. My students don't go up north because it's such a large difference, but we have many people up there. And we screen over 500 people a month just in September. We should probably do it another time of the year, right? Not just September. But that's one way to get involved, is to get out there and just provide free screenings at community health fairs, right? Or at senior centers, just
Yeah.
right around lunchtime is the best time to get there, right? Because you want them, a place where they normally go,
Mhm.
that they might not, think about they need a fall screening, but those are the people that are usually pretty shocked at their results, and we're able to help them find the resources that might benefit them.
Yeah.
Other
Prior
things,
to
though, okay, sorry.
I was going to say, prior to returning back to Georgia a couple years ago in Northern California, I participated in a Matter of Balance, which was a fall prevention program where they have a guest healthcare session, but it's part of a series. And so I was able to slip in and slip out for like a 1 hour session and talk about fall recovery. But they always had the clinical questions and wanted to know, well, how do I find a balance or fall specialist? And that was just a really easy opportunity to tell them about find a PT, while also talking to them about safety. So just a plug for another program there. But you were about to go somewhere else and I cut you off. So please proceed.
No. Well, it's funny is that I was going to also talk about another evidence-based fall prevention program. Matter of Balance is one of them, and really addresses fear of falling, which is so critical. I am an instructor of a couple different programs. So Stepping On is the one that we support here in Nevada. We have a grant to get that program up around the state every year. And that one has community experts come in. And PT, that's a great place that you can, collaborate with your community health educators, right? And come in for those expert days. And the physical therapist teaches them exercises, teaches them how to get up from a fall, and really comes back and also makes sure that they're progressing the exercises using ankle weights, right? Because we know you have to challenge them. And then the third program I was just going to mention is Tai Chi Quan, Moving for Better Balance. I mean, that program has seen tremendous results. Like the JAMA article most recently published was over 50% in people with Parkinson's disease, decreasing their fall risk by attending this program. And I'm a leader of the program. I can't do it as much because it's a big time commitment. It's 6 months, I think. It's 24 sessions, so a couple times a week, every week. You can shorten that to 3 days a week and then do it like 4 months worth. But luckily, we have some community experts in that really keep that program going, both virtually as well as in person. And I think us getting exposed to these programs helps us, number one, know where we should refer our patients to, right? Helps us be in touch with that instructor in case they ever find someone that they feel needs a physical therapist. And three, just interacts with that population and we can see the needs that they have. And we learn something every time we go to one of those community events also. So I'm glad to hear you were a guest expert at Matter of Balance. And, that is something I'd recommend any PT to get involved in as well.
Yeah, it's very approachable too. One time I wasn't able to make it, so I had one of the occupational therapists go, and they were very appropriate in that setting as well. Great opportunities in this rehab space and within the Alliance to help support. I also think in Northern California, we'd often do events at a farmer's market, where people are kind of coming through and milling around, potentially with fall risk or other screening opportunities. It's a good opportunity to be where the people are and have the PT brand out there under a number of different kind of umbrellas. So thanks for touching on all of that. That's really wonderful. So I have one last question, kind of take us in another direction. And again, it's a little bit of paraphrasing some of the past topics that we've touched on. But are there any other kind of unique approaches or specific kind of treatment paradigms that you would recommend PTs and PTAs be knowledgeable about? Whether it's dance or tailored exercise or other movement-based therapies, like kind of what comes to mind when we're beyond the community scale and now we're doing an individual kind of a one-on-one approach with someone who is either concerned about their risk for falls or has already fallen, but without trauma?
Thank you for that question, because it is so important that people stay active, right? And whatever their passions are in, we want to, really fuel that fire. And so, one, we know that variety is good for us. Like up to 4 different types of activities really help us just, round out our activity level, our fitness level. But dance has been proven to do so many wonderful things for people because they enjoy it and they get into it, right? Even people that have problems moving, like people with Parkinson's disease, right? We just need to find what it is that our patients like to do, or maybe that they used to like to do and they don't think they can do anymore, but we work on getting them back there because that really allows them to live their best life. And, I also think that the exercise, whether it be dancing, whether it's boxing, pickleball, whatever you feel that is something that gives you a good workout and gets you that social interaction that's so important for our brain, our mental health. Any type of activity out there that interests the person is great, right? We know that high intensity exercise, even for my patients who have stroke, right? All of the patients with Parkinson's disease, we need to get them doing some high intensity exercise. So how can we do that? Well, they're not going to want to do it to things that they really don't enjoy doing, right? So how can we incorporate? First of all, we got to get them to that level in physical therapy. This is where your heart needs to be to make, you keep your fitness. And then how can we incorporate it into your routine? And, any type of activity lends itself to, we can get high intensity in there, intervals, right? We don't have to do it continuously, but like even for 19 minutes, a minute on, a minute off, or 4 minutes of a Tabata, any of those things, right, can help a person really improve their fitness level or at least maintain it. But my guess is improve it. And so find that thing, right, that really helps them, or find a couple and try to help them get connected socially to that, because those are the connections that help get that consistency, which is what we overall need.
Yeah, that's fantastic. You create a great visual of, the path to fall prevention being through the heart, whether it's, in your chest through that capacity or in, your mind of what you're passionate about. I think that's a really powerful suggestion to our listeners and viewers as they think about, how to engage with each person one-on-one within their care. Jen, this has been just a really wonderful conversation. I want to, give you the opportunity to have any closing thoughts, but I can't wait for this podcast to go live as part of PT month, and I'm very happy that Orthostatic was able to have you on today. So what closing thoughts do you have for us?
Well, first, thank you. Thank you for reaching out to me and allowing me this opportunity to talk to a different viewership than I normally do. So this is exciting. And I actually look forward to trying to have more alliance with the orthopedic section or academy, because I think all of our patients, right, they have an orthopedic as well as a neurologic system. And so more that we can do to combine our efforts, the better, I think, practicing therapists we are going to be. But my fall prevention thing, I feel really happy that APTA chose fall prevention as this month's, this year's theme for PT month. And so think about something you can do. Can you even go on to the National Council of Aging's site and grab some of their social media and post it? Just increasing awareness about falls. Can you think about making sure you know the fall risk of every one of your patients? Just ask them, have they fallen in the last year? Do they worry about falling? Do they feel unsteady on their feet? You'll know their fall risk just if they give you a yes to any of those questions, right? Just be asking them. And then how can we get that high intensity exercise when you're with them, and then continue exercise to keep them strong, right? We know we need strong quads. We know we need strong hip abductors, right? Those two are just highlights. Let's talk about the calf, right? You all know strength. So continue to push your older adults even to maintain that strength that they need to have good balance. And don't forget to practice balance reactions.
Excellent. Great parting thought. Thank you so much. If someone wants to follow you, you have great social media presence. Where would you most recommend that people look for you so they can follow along?
Well, I think that the two, like the special interest group as well as Nevada Goes Falls Free Coalition, are two great places. So AAOMPT, Balance and Falls SIG, or Nevada Goes Falls Free Coalition would be great places. Thanks
Excellent.
so much.
I was really impressed with all your hashtags that you said for Fall Prevention Awareness Week and Fall Prevention and Equity Promise. So keep an eye out for those hashtags as well if you're on social media out there. Thank you so much. It was a wonderful conversation. I look forward to engaging with individuals who want to post as this goes live. So thank you.
Thanks, Ben. Thanks so much.